Well, let's get away from the weather for a moment and talk about this very interesting story. You know, you can 3D print just about anything these days, and doctors at Tampa General Hospital are using that tech to help patients in an innovative way. They are 3D printing exact replicas of their patients' organs so surgeons can better prepare for complicated surgeries. Fox 13's Brianna Arredondo joins us live in the studio after visiting the lab today. This is very interesting, Brianna.
Yeah, it was very cool to visit this lab, Chris. So these prints are not going inside of bodies, but they are helping doctors understand your specific body in a better way. And all it takes is the doctor's request to the 3D print lab and some scans. Imagine being able to hold a piece of your own heart in your hand.
This is the aorta. These are the leaflets of the aortic valve, and these are the coronary arteries.
What cardiologist Dr. Fatima Tar is showing us is actually a 3D printed replica of one of his patients at Tampa General Hospital, so he can work out if a specific operation will work.
We print the heart and test that plug that's usually used for something else for this one and see how it fits. And then if it fits, then we go and do the procedure. If it doesn't fit, we say we're not going to do it.
The requests come in here to the TGH USF Health 3D printing lab.
This is replicating exactly what exists on a real patient.
This sound never stops. It starts with taking MRI or CAT scans through modeling software before going to these machines.
If it's a novel procedure or if it's a very unique case that the surgeon never did something like that before, he can train on the model that before going to the procedure.
6 printers run around the clock, building up one thin layer at a time. A prostate taking 3 hours or a congenital heart up to 70 hours.
So this was a gunshot wound. The patient lost everything, and we need to rebuild the whole face.
Dr. David Zill leads the lab. He says these machines can do more than help in the operating room.
So one of the biggest problems that we have here, we're losing some blood bags because they're getting too cold inside of the coolers. So instead of having the bags going to a very low temperature, we can create that insert that will keep the blood on the proper temperature, and then we'll be saving thousands of dollars for the hospital per month because we're not throwing those bags away.
Using the prints made a difference for surgeons like Dr. Matar. He says some scans overestimate the risks for patients and can count the amount of procedures that could help.
So it really helps us fine-tune our prediction of what's going to happen, the bad outcome, and then allows us to better treat and select our patients.
And the 3D print lab plans to expand to 8 printers soon, and they also help out lots of other departments there at the hospital, from OBGYNs to ear, nose, and throat and the Cancer Institute. The lab director says 3D printing tech can also help medical students get a better understanding of tough cases.